Hello good people, welcome to another episode of Gegobase. Today I'm riding solo. Leo niko peke yangu. My friend Dr. Nyabuti ameenda to attend on national matters about dentistry kwa nchi yetu nzuri. So today I'm going to discuss basically anesthesia. Okay, I think this is a part that people tend to have wanakosea, wanadhania ndivyo sivyo. Okay, anesthesia is basically you lose sensation of that part that you're working on, the mouth or basically the tooth or even the part of the jaw, but you don't lose consciousness. Sawa, you're still aware of yourself. Okay, so now what we use is something called local anesthesia. Okay, just as the term in explain, ni hapo tu kwa hiyo area unafanyia kazi. Okay, so basically when you come for dental procedure, a mostly invasive dental procedure, it can be a filling, root canal, extraction, anything that is invasive that may be traumatic, we do involve anesthesia. Okay, anesthesia in my setting right here, it can be either topical anesthesia and now the local anesthesia. Okay, now they have a difference. Okay, and they work synergistically, inafanya kazi pamoja. Okay, now we do have topical anesthesia. Okay, we have two elements. Okay, we can have the spray and the gel. Okay, now this cannot be used on their own, haitumiki peke yake. Okay, this one precedes this. Okay, let me explain. Hii inatumika sana kwa kupaka ama kwa kuspray so that you can numb, unatuliza hiyo area wakati mnadunga. Okay, now when I'm doing my job, this is a point, it cannot be pain free at all, but the pain can be less. Okay, so that is why we engage the topical to numb the area first before we come with the jab. Okay, now one thing you will know, and I will repeat again, when you come for a procedure, just be relaxed. Okay, because there's so much tension among patients. Yes, as I explained, it can't be pain free, but the pain can actually be less. Okay, but there are various ways we do go about it. Okay, before I numb, I prepare psychologically. Nitakuelezea nikwambie, listen, I'm going to numb this specific area, expect this, expect that. Okay, psychologically that calms you down. Okay, during procedure, be still. Okay, now that's your aspect as the patient. What will I do as the doctor? What causes an injection to be painful? Okay, basically this being my syringe here. Okay, what causes the pain during procedure is actually the pressure in the tissues during administering. So that is why you will find me, and even in my videos as you will see, that I actually have the anesthesia injected slowly, controlling, having less pressure in the tissues, either in the gum or in whatever area I'm actually giving my anesthesia. Now, some things to expect. Okay, the onset of anesthesia takes some time. Okay, after I have applied my gel, I have numbed you, I will give you a set of time. Okay, many a times it ranges between 5 to 10 minutes before I ensure my procedure. At times you may find that you are still in pain. Uko na uchungu bado, maybe if I do 1 to 2 things, don't worry, calm down. Okay, I may add my anesthesia and give you more time. However, there are some times that the patient is not able to achieve anesthesia adequately. Why is this? Okay, number one could be something psychological. Okay, too much anxious, too having phobia, having actually fear. Okay, that I will have to talk you into it. Number two, you may have infection. Okay, an infectious medium is not the best for having anesthesia, to achieve anesthesia. But how do you go about it? If I'm not able to achieve infection, then I will give you a prescription and schedule you for another date. Okay, now another thing that we need to talk about, anesthesia needs to find a situation in which the patient is actually well prepared. Okay, now in many cases you'll ask me, I will have me ask you some various questions, like for example, are you hypertensive? Kuna shida yote ya pressure? Okay, why is that? This one has a component called adrenaline. Okay, adrenaline is not favorable with hypertensive patients, so kuna shida ya high blood pressure. Okay, we take a precaution. Number one, if your blood pressure is actually managed, we can go ahead. But number 2, if you're a case of high blood pressure that is not well managed, we do actually anesthesia which is free of adrenaline, okay, to actually help you not actually trigger or actually cause an imbalance with your blood pressure. Another thing that you come at a dentist, come with stable blood sugars, okay? The adrenaline easily wipes out the blood sugar level that you have. Come have eaten, come have enough stable blood sugars to avoid things like fainting, which I think we explained in another episode, by the chair side, okay? Now, you are actually numb, okay? Procedure successful. What do you expect? Numbness, the numbness caused by the anesthesia is actually self-reversible, okay? So after about 15 to 20 minutes, it's going to start wearing down pole. Okay, so don't worry if you come here numb. Just avoid chewing, because you can actually chew on your tongue, chew on your cheek, chew on your lip. So avoid eating, just have fluids then, and then the anesthesia will slowly taper down. Okay, so anesthesia is actually a good thing. Okay, this is actually one of the best inventions we have in dentistry, because I'm imagining when you're having tooth extractions or surgical procedures without anesthesia, not so funny. Sawa. So when you have to when you're coming to for a dental visit, many a times we do use local anesthesia. There's no loss of consciousness, but only loss of sensation. Now, some cases, in extreme of cases, patients don't cooperate well with local anesthesia, especially special needs cases or even children. That is when we take it up to another step. There's something called sedation, which we're going to discuss. Basically, we put it to a state of sleep, or even general anesthesia, which is done basically where you lose consciousness, then you have a procedure. But that's a discussion for another day. So for today, local anesthesia is what we use in many case scenario. It helps you get through the invasive procedure, helps you to be comfortable, and yes, it is doable. No need to fear. Here at Gegobase Dental, we do take care of people who have fear, especially fear of needles. Jose, huwa mnaita belenophobia ama kitu kama hiyo, utaweka hapo chini. Sawa guys. Thank you very much. I think I've given you just a helicopter view of local anesthesia. Ask more questions hapo chini. Log into Gegobase. Thank you. Love your smile.